A proposal for patients at West Suffolk Hospital to benefit from state-of-the-art orthopaedic facilities. The NHS in Suffolk is planning to move around 1,500 planned orthopaedic operations, such as hip, knee, foot and ankle surgery, for people aged 18 and over, each year from West Suffolk Hospital in Bury St Edmunds to the Essex and Suffolk Elective Orthopaedic Centre, known as ESSEOC. ESSEOC is on the Colchester Hospital site in Essex, a new centre opening in summer 2024. ESSEOC is an elective surgical hub. The new surgical hub is part of a national scheme, which aims to provide hundreds more operating theatres and approximately 1,000 more beds across England. With surgical hubs being separated from emergency services, surgical beds are kept free for patients waiting for planned operations, reducing the risk of short-notice cancellations due to other emergency admissions taking priority. This protected orthopaedic facility, which provides 72 additional beds and 8 state-of-the-art operating theatres, will operate all year round. What are the plans? If your surgery happens at ESSEOC, your appointments and pre-assessments will still happen at a West Suffolk site. Only your surgery and care immediately after your operation will happen at ESSEOC. Your surgery will be undertaken by your local surgeon, unless there are any unforeseen issues such as staff sickness. Around 45% of elective orthopaedic surgery will still be undertaken at West Suffolk Hospital, including all services for those under 18. ESSEOC will make a positive difference for many hundreds of patients who have already waited a long time for their surgery, often living in pain and struggling to stay active. The centre will improve people's care and reduce waiting times for patients of West Suffolk Hospital. Thousands of patients across England have already benefited from travelling to a surgical hub in a different location to their local hospital. ESSEOC at Colchester Hospital is approximately 30 miles away, or around an hour's drive, from West Suffolk Hospital, which means some people will have to travel further. Listening to views. The NHS has asked Healthwatch Suffolk, an independent organisation which gathers the views of people about their needs and experiences of local health services, to carry out an anonymous survey. The survey will collect your views about these plans and how they will affect people's lives. As well as carrying out the survey, Healthwatch Suffolk will independently analyse the survey feedback received, which will be used to help the NHS make the best decisions for our community. We want to hear from as many people in the community as possible. Whether you are waiting for orthopaedic surgery, care for someone who is waiting, or you may need to access services in the future. Healthwatch Suffolk will produce an analysis report which will be presented to the NHS Suffolk and North East Essex Integrated Care Board on the 30th of July. Please visit www.suffolk-northeastessex.icb.nhs.uk/elective for further information about the proposal. West Suffolk NHS Foundation Trust's travel plan and equality analysis are also available on this page. Printed copies or alternative formats are available upon request. We genuinely want to hear from as many people as possible and will be making our engagement as accessible as we can to ensure everyone who wants to have their say can do so. In addition to the survey, several outreach events and drop-in sessions will take place, which will allow people to hear more about the proposal and to ask questions. We also plan to promote the engagement with our local media partners, at libraries and local supermarkets, in GP practices and with local community groups. To complete the survey, please visit healthwatchsuffolk.co.uk/elective. It is a patient's legal right to choose where they wish to receive their healthcare at the point of referral. Patients can decide where to go for treatment based on what matters to them, such as short waiting times or being close to family or friends, and will be offered appropriate options. What our clinicians say. Andrew Dunn, who's Clinical Director at the Essex and Suffolk Elective Orthopaedic Centre, said, "There would be several benefits to patients across West Suffolk if this proposal were approved. For instance, more capacity would be created, which would allow more patients to receive their treatment in a shorter wait time. If agreed, the proposal would also free up an operating theatre at West Suffolk Hospital, which would allow clinicians to conduct more work on elective recovery. This would also create more capacity. Patients would benefit from receiving care and treatment in a purpose-built, modern, state-of-the-art centre that would be the largest of its type in Europe." Philip Vaughan, a consultant orthopaedic surgeon and Deputy Clinical Director of Surgery at West Suffolk Hospital, said, "The COVID-19 pandemic led to unprecedented levels of disruption on elective hospital care across the country. Even without further COVID-19 surges, additional elective surgical capacity is required to reduce excessive waiting times for patients. There continue to be significant increases in waiting times for local patients to be treated, leaving many in continued discomfort or pain while they wait. If approved, this new hub would provide extra capacity to enable us to address this and treat our patients more efficiently." To find out more and give feedback in your own language, please visit suffolkandnortheastessex.icb.nhs.uk/elective.